Hello guys, so this is the second part of hiatal hernia and fundoplication, which I was making notes. So we have done the definition, the types, the symptoms, the causes, investigations, and we were on the investigations: biopsy, esophagoscopy. Then the second is the barium swallow. Barium meal. So in this, what happens? We give the meal, we give the solution to the patient, and he drinks it, and then we see under the X-ray. We see under the X-ray if the hernia, the protrusion of the stomach is present or not. Protrusion of esophagus, stomach we see. Okay. So in the mnemonic, we were at doctor exerts pressure, tube, biopsy taken, white solution, X-ray. Yes. X-ray protrusion of stomach, esophagus, stomach. Then comes to the barium meal हो गया. Then ultrasound. We look for any other causes like retroperitoneal causes, pancreatic tumors, to rule out other causes which can lead to hiatal hernia. Okay. And we did retroperitoneal causes, pancreatic tumor, and barium meal or swallow, not barium enema. I forgot to tell you that we do this procedure in Trellendenberg position. Trellendenberg's position. In this, the patient is light supine. So like this is the bed. So this is the foot end, head end, 15 degree. 15 degree, the head is here and the legs are here, so the patient is put into this position. Okay. Ultrasound retroperitoneal causes pancreatic tumor we see, or we see gallstones. Okay, these are the investigations which we do. Then comes the conservative management, treatment. In treatment, first we will do conservative management. In this, first is the lifestyle modifications. Not a good color. First is lifestyle modifications. Weight reduction, decrease fat and sugar in diet, and increase protein in diet. Avoid alcohol and tobacco. Then medical management. In this, first is medical management. We have esophagus mucosal protection, esophagus mucosa protectives, Mm, First is alginates. Then comes the H2 blocker, ranitidine. Then proton pump inhibitors, omeprazole, esomeprazole. This is the medical name for esophagus mucosa protectives. Then comes the for esophagus reflux. We have cisapride, metoclopramide. And for gastric reflux, we have domperidone, and we have metoclopramide. Esophagus protectives, reflux preventions. Decision for surgery. We do fundoplication. In fundoplication, nascence, full fundoplication, 360-degree rotation of fundus for 2-3 centimeter. Decision of surgery. Fundus is rotated. Nascence intra-abdominal esophagus. Restore 2 to 4 centimeter of intra-abdominal esophagus by reducing the hernia. This first step, 2 to 4 centimeter of intra-abdominal esophagus. Esophagus is restored. By reducing the hernia. Then second step is suturing the hiatus. Repair of the hiatus. In this operation, fundus of the stomach is mobilized. In this operation, fundus of stomach is mobilized. By dividing short gastric arteries. We have mobilized the fundus of the stomach. Then fundus is brought behind the esophagus. is brought behind the esophagus and wrapped in front of esophagus. Loose wrap. Wrapped in front of esophagus. Loose wrap. I should add this in the mnemonic wrap. Diaphragmatic detecting then हो गया. And we can do this procedure laparoscopically also. There is increased early recovery, early discharge of the patient within 1 to 2 days. Minimum mortality reduces, mortality and morbidity is reduced. This is most popular these days. Then this is the total full fundoplication. Then there is a complication that too tight. Fundoplication. Gas. There is a gas syndrome that is known as gas bloat syndrome that occurs. Gas bloat syndrome. Gas bloat syndrome which occurs in this fundoplication is too tight. That results in also dysphagia. Dysphagia also occurs. Too tight fundoplication, gas bloat syndrome, dysphagia also occurs. Gas bloat syndrome, dysphagia also occurs. Then we have two others that are subdivided. Partial fundoplication. Partial fundoplication. That is Taupit and doors. Taupit or doors. That is anterior fundoplication. No, this is 270-degree posterior fundoplication. This is 180-degree anterior fundoplication. So this we are all done with this topic. Hernia, hiatal hernia and fundoplication. This is the mnemonic which I have given. Fold the stomach around. I recovered after 1 day. Thank you so much guys for watching. Bye bye.